Welcome to the Manumission Podcast, the show dedicated to unshackling ourselves from the status quo. Here's your host, H.H. Morris.
Hey friends, I know it's been a very long time, so just wanted to let you know a little bit of what I've been up to, and I'm going to be kind of off and on here for the foreseeable future. So a lot of stuff has been going on in my personal life, a lot of growth in my company. There's just been way too much going on, and a lot of really good opportunities that have been coming down the pike for me. And it's just I haven't had the time to be able to sit down and make some new episodes. That's probably going to be the case for the foreseeable future. Like I said, just a lot of really good stuff coming on. I've always been very clear about the fact that this is more of a passion project for me to be able to talk to you guys and share some of my ideas. But nonetheless, I don't want to just call it quits altogether. But I did want to set that expectation that for the foreseeable future, I just don't see myself being able to have a good schedule or a set schedule for sitting down and creating any content. But stay subscribed in whatever podcast catcher you have, and here and there you'll see some episodes pop up. Now, I think it's been about a couple months since I last spoke to you. Now, obviously, a ton of stuff has happened, and I don't want to go through everything. You guys have probably, we're inundated with information in the media and everything, so you've probably heard from everybody and everybody's opinion about everything that's transpired. So I wanted to keep it to a couple of topics today that I think it could lend a unique perspective on, that has to do with current affairs, but that you might not be getting in other, whether it's traditional media or all the alternative media sites and even other libertarians and stuff, because I have, at least I think I have a different perspective on a couple of these topics. So the first one is First Amendment and the right to free speech. And my take sometimes can be a little controversial, even within libertarian circles, and definitely in just mainstream circles, because everybody just takes it as a fact that we have a right to free speech. It's a First Amendment right. In the Bill of Rights, it's the first right that's enumerated in there, and everybody just takes it for granted. Now, I'm not saying that we don't have the right to free speech, because as we've covered time and time again, when we're talking about natural rights, we're really talking about property rights. And so if my body is my property, then, just like we make the same case for something like, drugs or anything else, or, defending your body, whether with guns or whatever, that I can, if I wanted to shoot heroin, I should be able to and not be thrown in jail, right? If I want to have a gun to defend my life and property, I should be able to do so. I have that natural right. Well, when we're talking about free speech, we have to think about it in a similar way, in that, yes, it's my voice, my thoughts and the way that I express them. I have the right to do that. Now, just like the example of shooting heroin, if you're in my property, in my house shooting heroin, I can tell you to F off, right? I said, get the hell out of here. I don't want people just sitting here shooting drugs or whatever, or even if I didn't want marijuana and it says, hey, this stinking out the place or whatever, it's my call, right? If it's my property. So that property right overrules your property right in that respect, because you're doing it in my property without my prior consent. So free speech is no different in that, yes, you technically have the right to express yourself and say what you want to say, but just not everywhere, all right? So what we're dealing with right now with all these issues that have happened since we spoke last, with free speech and the Antifa versus the Trump supporters and First Amendment and free speech activists, these clashes in Berkeley and all these other schools, and you guys have seen all this. You guys are aware of all this. The problem here is, again, that the government, or the state, I should say, skews all these things and essentially turns all these problems into the tragedy of the commons, right? Because, again, we can make another analogy with immigration that we've also talked at length about, right? So the problem is that we have these common areas, and people are saying, well, these are common areas. If someone just, doesn't matter if they're from Mexico or wherever they're from, if they're just crossing through, they should be at liberty to do it. It's no one's private property. And so, that's what the open borders people say. But then other people, even libertarians, who might say, well, yeah, we get that in theory, but if the state exists, then the best way for the state to behave is as if we were in a private property type setup, and which means that they should control who comes in and out, just like you control who comes in and out of your home. So that's the controversy and kind of the internecine battle that's been going on there. And again, we've discussed that at length, but freedom of speech or free speech is no different, because what happens is, because we aren't in a stateless, free society, and because we don't have everything essentially privately owned, then we do have these common areas, and people have to be given this right by the government, so to speak, to say, okay, yeah, you have the right to say whatever you want. And especially because when it was first developed, it was because you should have especially the right to say something against your government, something that they're doing that you disagree with, and be able to petition against your government and be able to express any of your grievances, right? And again, we're talking about the tragedy of the commons, because in the scenarios that I outlined before with the different situations that you've seen on the news, is you're talking about schools, many of them state schools, and even in the cases that these are private schools, almost every university in the United States receives some sort of money from or funding from the federal government. So again, tragedy commons. It's technically something that, in quote, belongs to everybody. And so in those settings, anybody should be able to show up and give a talk, and people can hire people and say, hey, come give a talk about X topic, no matter how controversial it is, and no matter how much it might offend certain people. That's the way it should be, right? And then there's the other people, the anti-fascists, which are Antifa, ironically, who basically want to say, no, you don't have the right, because we disagree with this, and your speech, what you're saying, the content of it is so inflaming, and we hate it so much that we have the right to essentially shut you down and to force the institution, whatever it might be, to basically tell you, that, no, sorry, you can't speak here. All right. So again, we have this state involvement, this kind of fictitious setup that the state creates, that creates the problem to begin with. And so, yes, if we are going to look at the world through the prism of the state, which is how things are, that's the status quo, then yeah, you would have to have, or it would be best to have this, nebulous freedom of speech thing, because yeah, there's going to be areas where that are technically owned by everybody, and that everybody's going to want to use, right? So then that's where we come into the problem, because then everybody wants to use that thing for their own ends. And then that's how you start getting certain things getting hijacked. And so in the school, which is a bastion of, especially, universities are bastions of liberal, leftist ideology. I mean, is it surprising to anybody that they would not be amenable to anybody who's not a leftist, right? That they would not essentially be okay with right-wingers, conservatives, or just anybody that's not, or even libertarians. I mean, anybody that's not on the left, that they would essentially be biased towards those people and those speakers. Of course, right? But this is only the case, this is only perpetuated because of intrusion from the state. Because if those universities did not receive, if you didn't have state universities, first of all, right? If you didn't have actual state-run schools, which are funded and run by essentially government and government employees, then that wouldn't be an issue, They would all be private, and even including the existing private schools, like I said, who almost all of them receive some sort of funding from the government, right? They would all be without state intervention in education, without any of that meddling, any of those funds. Then they were all basically left to fend for themselves. Now, I would definitely expect that there would be these very ideological institutions, right, that are hard left, which they pretty much already are. And then you're going to have other institutions like Liberty University, or you have what's the one up in the Midwest, Hillsdale College, things like that. But if they were all that way and they all basically had to make it on their own, and essentially people had to voluntarily either give to those schools or go to those schools and pay the tuition and all that stuff, then what would happen is then they would have to be competing against each other. And so if you're way too ideological and all you do is just strictly, let's say right-wing stuff, and everything that you teach in that school is through the lens of the right, then you're going to have certain people come out of that school with limited skills. I mean, in all honesty, if you're also being the equivalent of what the left is today in schools, in academia, you're probably going to miss a lot of stuff too. So what would happen is that then the incentive would be, okay, let's turn these into institutions into what they should be, which is these arenas where everybody is exposed to a large swath of different opinions and different viewpoints and worldviews, right? And at that point, those would be the schools that would be churning out the most successful people, the people that are most prepared to deal with the real world, right? People that have actually been exposed to different types of thinking, having had to support whatever their arguments are, having been exposed to people challenging their arguments and their opinions. And you're going to get people that are going to come out of there very prepared, with grit, with a lot more intellectually sound ideas, and not these snowflakes that we're churning out in current academia. Because all of these people, what they're going to university for these days is essentially an extension of high school, and in a forum where it's even safer than it was in high school, because now that they're a little older, they say, and they can actually, but they're adults, they can actually say, no, you owe me to provide me first of all, I'm paying, so I'm telling you need to provide me a safe space from people that look different than me, act different than me, think different than me, and otherwise I can't learn in such an environment, because I'm constantly feeling threatened and all the stuff that you see. And this is all driven by the social justice warriors who have been essentially creating this environment in academia for the last 30, 40 years. And again, there is no incentive to change here, and it's essentially just an echo chamber, and it's just all these leftists just talking to each other and teaching, future leftists. And then all of those people end up in places like, the media. And all of these journalists are coming from these types of schools. And then we ask ourselves, why is it that the media is so biased? And out to the point that even the mainstream media doesn't even see. They don't even recognize that they're so biased, because that's all they know. That's all they know. That's all the people that they hang out with, all the people that they've studied under, that they studied with. They are all in this bubble, in this echo chamber. And so whenever they see something that's even remotely right, to the right, they say, well, that's completely absurd. I mean, obviously no one thinks that way, or no right thinking individual would ever consider that. So obviously these people are lunatics. And so we're going to, we need to show the world that these people are out there saying, but then they don't realize that it's actually the other 50% of people in the country that believe such things, right? So that the problem is all, again, going back to the tragedy of the commons. Because we have these common institutions, these common areas that everybody's fighting to use them as tools to get their to put forward their ideology, or to advance their agendas. And so it's it's an ongoing thing. It's a perpetual back and forth that is never going to end as long as there is this centralized authority that has to somehow figure all this out, because that central authority at one point is going to side more with the right, and then in some cases it's going to side with the left, and back and forth and back and forth. All right. So again, when we talk about free speech, I think if we look at it that way, we realize that just simply fighting for the right to free speech, to me, is almost incidental, or it should be almost like something that is, again, I'll give you the analogy once again of the immigration points that I've discussed, which is, yeah, even if in theory, and if you're making an argument for, freedom and the freedom to travel and the freedom to do this or that, then yeah, you'd be right in theory. But we also need to think about working big to small, because we usually get the most bang for our buck if we work big to small. Because if you solve a lot of these bigger issues, then a lot of these other smaller ones start kind of falling into place or fixing themselves. So in my opinion, I think we should spend our time on getting government out of education. And if we get government out of education, then we're going to get, precisely the circumstances that I described earlier, which is everybody's on their own. If I'm a right winger, I know that my money is not going to go to any left-wing institution, and the left wingers the same. They know that they're going to go to their own schools, they're going to go to whatever, to whatever institutions reflect their worldview. Okay, so be it. And then once everybody is kind of doing their own thing, first of all, peacefully and voluntarily, and no one's property is getting expropriated to do something that one group or the other is not okay with, then the incentives start popping up. Okay, we need to do something that's better than this, because a lot of our people aren't, or even most of our people aren't coming prepared to the world, and we need to actually have schools where we expose people to a large variety of opinions and thoughts and points of view and all that stuff. And I've made the same case with the media, right? Which is the media, that's what's happening right now, which is so polarized, so divided, that the pendulum is swinging the other way, because for so long, the media has been basically in the tank for the Democrats, at least here in the U.S., and in just left-wing, essentially, that mainstream, that you're getting this pendulum to the right, where you're having these alternative media that's also, pretty right-wing. And then, well, that's also not the solution, right? You are going to get this polarization, and then, yeah, you're going to get to a point where the media outlets, the mainstream media outlets, essentially has to come to terms with the fact, yes, we are all, leftists. That's our point of view. That's where we're coming from. And all the right-wing media, they've been upfront about it forever, which at least I respect that. I mean, I've always known where Breitbart is coming from. I've always known where Rush Limbaugh and Hannity and Glenn Beck and Fox News, I've always known their point of view, where they're coming from, right? So even though I might disagree with a lot of what they say, even most of what they say, then I've always known that. So at least they have that. It's the mainstream media. The problem that we're going through right now is that the mainstream media is still trying to hold on to this idea that they are, ironically speaking, the fair and balanced ones, that they are the ones that are these dispassionate, objective, fact-finding, group, when they're absolutely are not. And to think that they are is absurd. So once we have this complete division of right versus left media, and everybody's kind of upfront about it, then what's going to fill that void are the ones that are going to say, hey, we can't do either. In order to get more eyeballs, in order to grow, and in order to set ourselves apart from these two, poles, we're going to have to be absolutely factual, dispassionate, and objective. And then boom, that's when you're going to start seeing that. But until that happens, it's not going to. So again, same thing with academia. And the only way that that's going to happen is if we get federal money, just government money in general, out of education. All right? So Again, yes, fine. I'm good with the freedom of speech. Yes, I get it. We should have it, and it's something that is worthwhile standing up for. But again, you're never going to get rid of this problem as long as you have, especially in schools, because the freedom of speech, no one ever, is said, hey, I have freedom of speech. I should be able to come up, go into a mall and get on a soapbox and break out my megaphone and spew whatever ideas I have, right? Right wing, left wing, whatever, and rail against this or that, or support this or that candidate, whatever. We understand that that's not the case. The whoever owns the mall and the security would be quick to just grab and say, hey, you got to get out of here. You're even if you might have some people in there that would agree with you, the people that own that property would be right to say, hey, get out of here. We don't need this. People are out here shopping. They're having a good time, and you're getting in everybody's face, and you're bothering them. Get out, right? So we understand that already. The problems where we have these issues with the concept of freedom of speech are just in these common areas, in state-owned facilities or state-funded facilities. So just keep that in mind, and if you look at it through that prism, I think more of this will make sense, and you'll realize how some of that frustration that you might feel when you see things like that happening is that it's part and parcel of the state being involved in all of these things, all right? And if you see it as a function of the tragedy of the commons, I think all of that stuff will make a little bit more sense, and you'll see how the real fight is in getting government out of, well, mostly everything. And in that case, then you don't have an issue. People go where they're invited and to speak, and no one can stop them. If the property owner wants them to come in and give a talk or a speech or a debate about X, they're free to do so. And anybody that shows up to protest can get kicked out because they're just bothering the people that paid good money. They paid their tickets, right? They paid to be there. They might have donated. It might have been a ticket. It might have been whatever. It might be voluntary, but they show up and they want to be there and they want to listen to whatever it is. They should be able to consume that. And so if people just come in and start picketing and throwing things and whatever, then yeah, if they're bothering people, they should also be removed, right? They should be physically removed because they're in someone else's property and they're getting in the way. And again, this goes for both scenario, right, and left-wing scenarios. And I mean, that's a better way than to try to give everything to everybody all the time, because that's never going to happen. You're always going to have, we saw that with the mayor of Berkley, who's a big lefty. So obviously, you would expect that he's going to use his power to be more on the side of the, Antifa and the left-wingers and come down, against the right-wingers. And, probably the same thing would happen if you were to do something like that in Texas or whatever, some red state. And so you never really get rid of the problem. It's always just the same thing. So you're going to see is these divisions get more and more strident, more and more distinct, and you're going to see more of these things happening more often. And again, it's not really anything that's satisfying, because it doesn't even get us anywhere really. Just people yelling at each other. And so the other topic that I wanted to discuss, because it's also in the news right now, is healthcare and insurance in general. So I don't want to delve into the particulars of the Trump care and Obamacare and all these things, because I'm sure you guys have been reading a lot of that stuff, and some of you guys might not even care, and I haven't read the damn bill or anything, so I don't know. So I just want to talk about in the concept of insurance and why we are also having these types of issues, especially here in the United States, when it comes to health insurance. Because I've actually been in the insurance industry, in the property and casualty side, not in healthcare or health insurance, but it's very similar. I mean, we are regulated by the same entities, the departments of insurance of each state, the insurance commissioner of each state. They basically all function very similarly, and a lot of the same concepts apply across different types of insurance. And to me, the biggest issue, and it's not going to surprise you, is government interference once again. Well, why is that the case? Well, because we have to be able to distinguish between two things, first of all. One is the quality of medicine, right? The quality of the actual service. And the other is access to it, right? And access to it. And there's also kind of a third thing, which is insurance and the affordability of health insurance. But health insurance and the affordability of health insurance depends on the former, right? So if we're going to talk about having a good high level of quality medicine in the country, let's say, then you also want it to be affordable, right? Because if you have good doctors and you have affordable prices, then insurance is almost a secondary thing, right? Because if I know that I can go to a doctor, I have good doctors, good technology, good medicine, then and I can afford it, or at the very least, it's not going to bankrupt me or completely turn my life upside down if I have some minor to moderate health issue, then insurance is not neither here nor there, right? If I can go to the doctor, I can pay $20 to see my primary care physician just to get my checkups or whatever, and I can get cheap medicine over the counter or even in prescription. Then what's the big deal, right? What's the problem? Well, there isn't one. So the problem is price, right? So we have this great medicine, and in the US, you can't deny that they have the best medical system in terms of they have the best technology, most advanced, the best doctors and all that stuff. And the only thing you need to do to recognize this is that where do all the rich people in the world go when they're sick, right? And they'll pay out of pocket. They don't forget the whole insurance thing, right? They might be from the UK, they might be from Australia, they might be from Mexico, they might be from Canada, whatever. All these people that that are millionaires or billionaires, if they're going through some significant illness or whatever, they come to the United States. And again, they can pay for it out of pocket. So insurance, again, for them is not an issue. So that's when we come back, again, to the issue being prices. So what drives up the prices? That's what we need to focus on. Okay, because most of the conversation is on, access, and not only access to medicine, but access to health insurance. Again, health insurance is only necessary because the medicine is so expensive. And what happens is that, especially the people on the left, they don't realize that it's most of the things that they have called for in the past, the progressives, that have led to such crazy prices in the US. All right? So the one thing that I never understood, when I first came to the United States, I mean, I was young, so it wasn't something that I really, analyzed or whatever, but even as I got older and older and I saw things, where my parents getting insurance and all these type of things and how people had, handled their health and things. One of the things that stuck out to me is, wait, why is it that people get health insurance through their employer? Like, that's just ridiculous, right? I mean, it made absolutely no sense. I'm like, so you're telling me that I might be with a company, working for a company for, let's say, 10 years. And so, well, I'll give you, for instance, an example for me. I've been with my current company for, it's going to be 11 years next week. Wow. 11 years. So I've had the same insurance through my employer for 11 years. Now, let's say I get hired somewhere else. Someone makes me an offer and says, hey, I want you to come work for me, give you, more money, better benefits, the whole 9 yards. But that health insurance company that they use is a different one from the one that I have currently. So for 11 years, I've paid premiums into this company, and now, boom, they're gone. They just disappear. Now, thankfully for them, I never had any major, medical incident or anything like that. So, they're happy. And then now I go to this new company and I start paying into this new health insurance, completely different. And, a couple months into this new job, I get diagnosed with cancer. Right. So then this other company for 11 years got all this money and didn't have to pay out, much in terms of claims for me because I was healthy the whole time, and they just got to keep that money. And then this other insurance company, just because I work for this new company, has to insure me. They cover me, and only 2 months worth of premium payments, I suddenly are looking down the barrel of probably $100,000 in medical bills from radiation, chemotherapy, whatever, the medicines, the drugs, whatever. So that makes no sense, right? That makes absolutely no sense to me, because there's no reason why your health insurance should be tied to your employment, because it should be like any other insurance. And you say, well, I'm going to get this insurance, this health insurance, because I like their service, I've seen the reviews, okay, this is the type of coverage, and this is what fits my budget. Okay, that's what I'm going with company X. And so I make my payments directly to company X, just like I do with my car insurance. I just pay my monthly premium, whatever it is, and I just carry that with me wherever I go. So it doesn't matter if I move from this state to the other. I should be able to keep that same company. And imagine the last 11 years, if I've been paying, or even more than that, even before I started working with my current company, since I started working at 15, right? So you're talking about, almost, more than 20 years worth of premiums to this one company that I've always had, right? Now, if I go to a new place, they might want to give me as a benefit, hey, we'll pay half of your premiums. You pay half of it, start paying 50% of what you used to pay, and we'll send them a check every month for the other 50%. That's cool. I'm like, hey, that's awesome. That's an awesome benefit. Thanks, man. That's one of the reasons why I wanted to come work for you. And perfect. But it doesn't have to be the employer directly being the one that manages any of that, or has to come up with the contracts and the plans and whatever with the insurance companies. It should be the individual, right, that deals with that kind of stuff. Now, if that was the case, and we also had a system in which the government wasn't involved, then that would spur consumerism, and not the typically bad consumerism that we think of when we think of that word, that we have that negative connotation where people are just spending money and trying to buy things to kind of fill a void in their lives. We're talking about shopping around for better prices, right? Because when a third party pays, then the pricing always increases. Because if you separate the service provider from the customer, the only thing that can provide that can result from that is the pricing increases. Because if I'm a customer and I'm not paying out of my pocket, right? And the hospital says, hey, it's going to be $100,000 for this to treat you, and I say, yeah, okay, 100,000. I don't care. My deductible is $1,000, so I don't care. 100 grand. Hey, insurance company, you pay it. And they're going to say, oh, wait, we're going through all the things that they're charging, and you really don't need that, or they're overcharging for this, or blah blah blah. And then now you get a third party getting involved from the beginning, and the hospital or whoever is providing the service next year is just going to increase their prices to make up for the fact that whether it's the insurance company or the government didn't reimburse them for what it is that they wanted. But if the consumer was to shop around for the best pricing from the beginning, just like you would shop around for the best price for the shoes that you like, or for a laptop, or for anything else, and we just went around and said, okay, is this the same acceptable level of quality of service and care that I'm looking for, and what's the price? Okay, let me look around. Well, this one is similar, but they're actually cheaper. And if we approached it the same way, and I think a lot of people have a hard time with that, because they're like, oh, we're talking about health and we're talking about humans, and we can't just look at it the same way. But just because we're talking about humans and people getting sick or things of that nature, doesn't mean that the laws of economics just cease to exist, right? So if you had a free and open market in which, again, there would be a role for insurance in that case, but it would basically be strictly for catastrophic care. Because like I said, if I can get all the care that I need from anything from something basic, from a cold to a flu shot or whatever, to, maybe, breaking something, or, getting hit by a car and having to get, breaking a couple of bones or something like that. And I can essentially pay for it out of pocket. And even if I don't have the money in my bank account to pay for it, that I can essentially get a personal loan to, cover the $2,500 or whatever that the bill would be. That's not going to bankrupt me. And the monthly payments wouldn't be much different than it would be what they are currently, as expensive as health insurance has gotten. My health insurance since Obamacare has tripled. And the plans have gotten progressively worse. Every year they cover less and less than what they used to. We used to have a really, what they called back in those days, a Cadillac plans almost, where it covered a ton of stuff, pretty low deductibles, whatever. Now I'm paying 3 times as much for a huge deductible. So I have now my deductible is up to $9,000. So in a year I'll pay about $15,000, and I'll pay half of it because my employer pays the other half. But you get the idea. It's a $15,000 premium per year, but I first have to pay the first $9,000 in any given year until they start paying for everything else. So now we were essentially by force getting back there, which is now you're really only covering things that are catastrophic. I mean, there's a lot of stuff that you can have a lot of different little health issues here and there in 1 year and never even get close to the 9,000. So obviously, the only time that I would ever take advantage of that health insurance is if I did get something severe, like cancer or any other illness that will require a significant amount of treatment, right? So again, it's almost like we're going to get forced into it. Oh, and by the way, because of that very high deductible, I just pay out of pocket almost for everything now. And I've been able to bring down the price of everything that I pay when I tell them, hey, I'll just pay for it out of pocket. You don't have to do any paperwork. You don't have to submit anything to my insurance company. How much will you charge me? And if the thing that they were going to charge me, the service was going to be $100, they'll be like, oh, cool. That'll be $70. Just like that. Why? Because they know that they don't have to play this game with the insurance companies or with the government in the case of Medicare or Medicaid, where they have to go back and forth, submit the thing. Everything has to be in the right categories, it has the right paperwork. Everything has to be reviewed, this and that. And then maybe 2 months later, they might get a check for 80% of what the service provider wanted or asked for. Right? So they might as well just say, hey, fine, if you're going to pay out of pocket, I'm going to get that money in my bank account deposited tomorrow, then yeah, I'll give you a 20% discount. In some cases, I've gotten 50% discounts from their posted, rates or costs for the service. And that's what we need to spur again. All right. So the insurance is incidental to this problem. And neither Obamacare nor Trumpcare address those issues to a significant extent. Because again, if we're going to work big to small, we get the most bang from our buck by getting the government out of healthcare altogether. If the government isn't trying to negotiate rates and is trying to undercut and underpay but all of the service providers, healthcare providers that they deal with, then the health care providers wouldn't have to increase their prices to make up for that, and have those increasing prices have to be paid by the private insurance, right? And if the private insurance didn't have to pay those inflated prices, then their premiums wouldn't go up every year. And if their premiums didn't go up every year, then more people would be able to afford health insurance, right? Or even forget that, like I said before, those prices stay low, stay manageable and reachable, then most people would just pay for their healthcare services out of pocket unless you have a catastrophic event, at which point you do get insurance for strictly catastrophic events. And in that case, you'd only be paying, $50 a month for health insurance. And if you ask me, that's probably a good deal. If you say, hey, $50 a month sent for my catastrophic health insurance, and I know that if I end up getting cancer and end up getting some crazy unknown disease or whatever that's going to require hundreds of thousands, maybe even millions of dollars to treat, then hell, that's a good deal if you ask me, $50. But now I'm paying essentially $800 a month, and I don't even get to use my insurance until I've already paid $9,000 out of my own pocket. So this is completely insane. I wanted you guys to understand the differences and that you need to be able to differentiate between healthcare, health insurance, and also quality and price. Because you might also have a place that has universal healthcare. And if it's shitty, then what's the point? I mean, Cuba has universal healthcare. Venezuela has universal healthcare. Do you want to go down there to get treated? No. But it's free, quote free, what we mean by that, right? Somebody always has to pay. And so we have to address the issue of price or cost in order to actually start making a dent in this problem. And a lot of the people that were for Obamacare and they're railing against Trump care, mostly on the left, they're patting themselves on the back. They're so big-hearted, and everybody, Jimmy Kimmel came out with this thing that everybody deserves to have the same level of care. Well, you know what? You're not being compassionate if you're actually pointing a gun at someone and say, you pay for my health care. And by the way, by you creating the system of forced taxation to cover all these things that you want, you're actually decreasing the value of healthcare, not just for that person, but for everybody. That's not compassion. That is faux compassion. That's virtue signaling, and that's just being ignorant as to basic economics. So we can't fall for that. And we also have to hold accountable the people on the right that have the blinders on for Trump and think that this is actually some sort of a solution when in fact it isn't, right? And if you're going to have a concept as allowing for pre-existing conditions, then that's no different than saying, I just got in a car accident, I don't have insurance. I call the insurance company and say, hey, I want an insurance policy on my car, and by the way, you need to come fix it as soon as we're done here because it's already been in an accident. They say, no. We insure for possible scenarios, not for things that have already happened, because in that case, it's no longer insurance, it's just a payment plan. And that's exactly what Obamacare is and what Trump care is in those situations where they have to accept pre-existing conditions. If you already have a condition, then and they have to cover it, then that's not insurance, because it's not a possibility if you're getting sick. You're already sick. You're now only making monthly payments to, like I said, it's the equivalent of getting a loan for your disease or for your illness and paying it back monthly, right? So remember, that's not insurance. It's a payment plan when you're dealing with pre-existing conditions. And again, that wouldn't be a problem if I just carried my own insurance for the rest of my life. I have a whole life insurance policy. I'm going to be making the payments to that same insurance company up until the day I die. So if I live, another 40 years, let's say another 50 years, for those 50 years, I will have been giving money to that same insurance company. And it doesn't matter where I lived. It doesn't matter, all the different places I worked for. None of that matters. The same company is getting that same premium payment every month, even if I live another 50 years. Well, health insurance should be no different. That pre-existing condition should not even be an issue because, I've paid in for 11 years when my premiums are 20 years or whatever it is, and then I get sick, right? But at least the company already has received all this money from me that can help to mitigate that because they already have all of these premium payments from me, and they're going to be much more likely and helpful and willing to pay for my bills when I do get sick. But if I'm bouncing around jobs and I'm always end up in a different, with a different insurance carrier, then the ones that, where I never got sick, they're, no sweat off their brow. But then the one that gets stuck when I've been there for maybe only a few months or maybe a couple of years and hasn't received that much money from me, and they still have to cover my illness, then guess what? They're probably going to push back and say, hey, we're gonna look at these at this invoice and see where we can cut some of these costs, or where we can try to go around the healthcare provider, or screw them out of this or that, or just deny outright certain services and refuse to cover it. That's how you get into this problem. And that's how the insurance companies, not just the health insurance companies, have turned into outright monsters. And I've seen it firsthand working in this industry, because all of the things that you hear people complaining about in terms of insurance, oh, the big bad insurance company, oh, and they deny people for this, and they hate paying for that, and they always make it difficult. Almost all of the instances where that happens is because of government intrusion and regulation. Because other than that, it would be the simplest service in the world, and it's a great and very necessary one, which is people with capital saying, life is risky, you're afraid, we will essentially take over the risk for you. So imagine how incredibly powerful that is. That we know that we might get involved in car accidents, or that we might get sick, or that, a myriad of different things that can happen by just simply existing. And that there are entities out there that are willing to say, hey, if something goes down, we got you. Shouldn't that be something positive? Shouldn't be that something that we say, hey, thank goodness that something like this exists? But instead, it's because government coming in and saying, hey, we're going to help you from these big bad insurance companies. And many of them are. I'm not trying to defend business here. I'm trying to defend the market, because the market would keep these companies, a free and open market would keep these companies honest. And it's because they have to go around all of these silly regulations that the government imposes on them, that they then also have to get creative and have to, watch out for more for the bottom line than they do about their customers. All right, a lot of stuff there, guys. Nice to talk to you again. Don't know when the next one will be, but I really do want to have an episode on economics and finances and share some of my thoughts on where I think the economy is going, as well as share with you some of the ways that I've been able to find more financial freedom and security. And so hopefully within the next couple of weeks, I'll have something like that out there. All right. Until then, take care.